Joining us again this year is Dr. David Callender, consultant ophthalmologist, consultant with the ophthalmology department at the Queen Elizabeth Hospital. Good morning and welcome.
Good morning, thank you.
Good to have you with us today. Happy World Sight Day.
Thank you very much.
All right, let's talk a little bit about this particular theme, Children Love Your Eyes, which you are continuing. As we discussed, there was an initiative that was started last year and continues even this year.
Good, thank you. Good morning, viewers. First of all, I want to thank you for inviting me or accepting our desire to be present. We have been involved in a school eye care program for over 50 years. And what we recognize is that children who are sent to be checked ideally were discovered by teachers who noticed there may be a problem, or maybe some parents. And we decided, or we felt that a better way to approach the problem was to screen children ourselves. And we started last year. We did a pilot where we screened first formers, and now we've embarked on a program where we're screening first formers every year between the months of January and June. And we'll screen persons entering school for the first time between July and December. So the whole idea is to catch or identify children who may have eye problems before they start school or before they start the secondary school education, rather than depend on teachers to identify those who may have a problem, so that we expect a bigger yield of patients. We catch them earlier, we can intervene earlier, and give them the best education experience that they can get if they have good vision.
Are there specific diseases or conditions that affect children specifically?
For sure, we have conditions that kids may be born with that we call congenital, or some may develop early in childhood. And you know, a lot of kids are nearsighted, they need glasses. Some develop problems from injury, and some develop problems from other underlying conditions. But first of all, I'd like to speak a bit about the nearsightedness that we see. We see a lot of patients who are nearsighted, a lot of kids. And recent evidence has shown that, unfortunately, pandemic, indoor activities and lack of outdoor activities and all devices have increased the incidence of nearsightedness worldwide. So a lot of parents ask, how much time should our kids have on the devices? Well, I would suggest that a maximum of 2 hours per day if possible.
That's per day, not per session?
Per day.
Okay.
Unless it is, of course, related to your schoolwork. But the constant close work with the phone and tablets as opposed to laptops has been shown by the National Institute of Health, a study they did that has increased the incidence of nearsightedness worldwide, and we need to maybe ensure that that amount of time is limited for the young children. So in addition to nearsightedness, we have lots of children who have eye allergy, and a few who are born with cataracts. They have to be removed as soon as possible. We also have had a screening program in the NICU, Neonatal Intensive Care Unit, for many years, where we screen babies who are premature, and we screen them for a particular condition that can cause blindness if not detected early. So that's been going on for the past 25, 30 years. Also, we have, I should emphasize the fact that we have a school-like clinic at Vincent Scott Polyclinic for the past 50 years, where children who may seem to have a problem are referred primarily from the teachers at school. But now that we have the disseminated screening program in 3 other polyclinics, they also refer from those polyclinics. And there's a free service that we offer to children who may need glasses, who need to get their eyes checked. And if they have problems more than just glasses, they refer to me at the hospital for further intervention.
And that's what ages?
Any school child.
As long as they're in school?
As long as they're in school.
Okay.
Up until 6th form if they're in older secondary school. So this service is free, and we need to make better use of it. Now that we're screening in 3 other polyclinics besides Vincent Scott, and these are Oystins, Brantford Tate, and Eunice Gibson, kids who are detected to have a problem are also sent to the main clinic of Vincent Scott for glasses if they need glasses, or for further management of their conditions. And a lot of them come to me if they have medical or surgical problems. I want to emphasize that this service is free. We encourage parents to make use of it, and we've been identifying patients or we're encouraging patients to come when they get their vaccination certificate for school. We encourage parents to make the appointment to get the eyes checked, if you want to go that route to get the eyes checked.
Often for a lot of people, the only time they more or less get the eyes checked is if they go to the doctor and the doctor says, you see that little screen at your GP that you kind of read through. But in your profession and based on what you've seen, what age would you say is an ideal age by which a parent should at least get their child's eyes checked?
Well, all babies get the eyes checked generally at birth. If you're a premature baby, you get the eyes checked in NSU. But certainly before a child starts school or just about time of starting school, that's a good time to get the eyes checked. Some kids go through school not seeing properly, and their work as a result suffers. Some have been labeled dyslexic from my experience, and when they get their glasses, they can see the board, they become top of the class, so they're nearsighted. So if you get the eyes checked on entry into school, it's the first step in the right direction. If problems arise during your school time, the door is open to get your eyes checked privately or school-like clinic. If you identify your problem, or the parents identify your problem, or the teachers identify your problem, you get the eyes checked.
Well, I also saw the results of the study that you spoke about, with a lot more children presenting as, being nearsighted. And even the concept of it was just mind-blowing, to think that they're not necessarily focusing on things far out any longer. And because they're, like this a lot of the times is why we're seeing challenges with them. I know there's a lot of data going on about blue light and whether you should or not. In my own experience, I've experienced an optician who said the blue light feature in glasses really doesn't make a difference. But should you be, if you already have a child with an eye condition or who's wearing glasses, should you be concerned with stuff like that, like the feature to maybe rebuff some of the blue light and things like that?
Well, there's no doubt that the constant viewing of the devices which generate radiation causes a problem with eye irritation. The eyes may get dry, get red and sore. Anything that can mitigate against that, I will embrace. I wouldn't object to having the blue light filters in the glasses. From patients who've been experiencing the use of these glasses, they seem to be more comfortable. So, and lots of persons like secretaries who spend a lot of time on the computer, they seem to have some good results. So, I don't emphasize it, but if a patient wants it, I would not refuse to give it to them. But I think it has some benefit.
Yeah, for a long time we weren't necessarily seeing a lot of to maybe shift gears, and maybe this applies to children as well, because I'm seeing a lot more children of school age wearing things like false eyelashes. So people are manipulating the eyes a whole lot more. So, your thoughts on that and how that can add to the conditions we're seeing with the eyes?
First of all, my personal opinion, I don't think the ladies need to be wearing so much false eyelashes in the first place.
Especially ones that look like windshades.
And they also need glue to stick the eyelashes onto your real eyelashes. There's some patients where the glue irritates the eyes. Some of the eyes are hard to examine. The lids are so heavy, they can't get the lids lifted. May have chronic irritation. And there's some persons who wear glasses that the lids actually rub on the inside of the lenses. So I think that's really unnecessary to the large extent that we see it. And it serves no purpose, and it can actually cause irritation of the eyes over a period of time. And I've had patients who've had to get medication because of the glue used to stick the eyelashes on. So, unfortunately, I'm not sold on the false eyelashes, the widespread use of false eyelashes, especially in young children, school-age children.
I've seen a lot of school-age children with them these days, which is why I brought that up. So, generally what we want to reinforce on this World Sight Day is all of the options that we have. We want to emphasize that they're free, glasses are free, and it's all available to school-age children.
That's right.
So you mentioned that you can go out to any of the 4 polyclinics you mentioned.
Well, we have screening programs in Winston Scott Polyclinic. Randall Phillips, which is Austin's, Eunice Gibson, and Branford Tate. And these are primarily for school children. The first half of the year, we focus on kids going into secondary school for the first time. And this time, we're focusing on kids going to school for the first time. And we encourage parents to make use of the facility. And the test for the glasses is done at Winston Scott Polyclinic if they've been identified to have a problem. And they get the glasses free via the Winston Scott Polyclinic main office of the school-like clinic.
What's the process like of screening for people or little ones who might be a little nervous about someone checking their eyes?
Well, fortunately, we were donated with a special eye charts by the Ministry of Education. And these charts have different pictures we can use or symbols for kids. So we have, for younger children who may not know the letters, we have pictures of objects. And we use those to test their vision with each eye separately and together. We check for alignment of the eyes to make sure the eyes are not misaligned either in or out. And we look for red reflex to check, make sure that the pathway to the retina is clear. And it is not very difficult. It's just a matter of getting the kids' attention and playing along with them and see what you need to see. It's a quick process. And then we channel those that we found in various directions we need to go. It's not difficult.
Yeah, some people might be a little nervous, particularly when you're dealing with little ones, not being exactly sure what to expect. And then what about conditions of the eye? Pardon me for this, but maybe visual conditions. I know sometimes we talk about, there being some children or young people who are cross-eyed and nobody bothers about it. I know one of my cousins, she immigrated to the U.S. many years ago when she was maybe 6 or 7, and she was cross-eyed, and they corrected it. Mm-hmm. So she's not cross-eyed anymore. So, are these conditions that we can handle here as well?
Yeah. When the eyes are cross-eyed or divergent, we call that a squint or strabismus. The eyes are supposed to be straight. When the eyes are straight, you have better vision, you have better depth perception, you can judge distances better. So any misalignment of the eyes is not normal. The eyes can be made straight with a combination of things. There are some patients where the need for glasses causes the eyes to drift. And if you test these children for glasses and put them in the appropriate prescription, the eyes may go straight. The eyes may go partially straight or fully straight. Sometimes an eye is not seeing well, so the brain can't keep it straight. So you may need to patch the other eye to make the vision better, to make that eye see better, and hence a better chance of going straight. And sometimes we can do eye exercises to help to pull the eyes in to stay straight. Ultimately, we can have surgery to correct the misalignment of the eyes, and that's a very straightforward operation. That'll be my job for the past 27 years. So the eyes can be made straight. No child should have to grow up with cross-eye. A cross-eye means either this or that. You don't have to grow up with cross eyes. And many kids who may have missed the boat when they're younger can have it done in teenage years or even adulthood, because it's a very straightforward process. It's not difficult.
That's good to know, because there are so many conditions that I think sometimes we accept as that's what it is and it can't be changed. But owing to medicine and technology, modern age technology and so on, we definitely, can make those changes. These are things that can make a real drastic difference to the quality of life, what children experience in school, at home, and these are things that children can be often bullied for.
Most definitely.
So that's important.
The straightening of the eyes is not only a cosmetic function. It has functional ramifications. You can see better, and you feel better. There's less teasing, and the kids feel good about themselves, and makes them better off psychologically, and they do better at school.
Yeah, that's excellent. On this World Sight Day, I know that the focus this year is on children, but we've talked a lot about the impact of non-communicable diseases on our population as well. And I know that for some of these, that means that, your eyes are severely affected depending on what disease you're battling. So can we talk a little bit about how the eyes are impacted by non-communicable diseases?
Sure. First thing that would come to mind, of course, is diabetes. We have lots of diabetics in Barbados. It's recommended that all diabetics should get their eyes screened or checked for diabetic retinopathy, because that changes in the retina, which may be permanent, can impact on your vision in long term. So all diabetics should get their eyes checked for diabetic retinopathy on a yearly basis. Uncorrected or uncontrolled diabetes can cause problems in the retina that can be permanent, and these changes can cause blindness and can even cause a painful blind eye. So everybody who's diabetic should get their eyes checked. Hypertension, not so much of a problem as far as eye care is concerned. You may have hypertensive crises where the blood pressure is extremely high, can cause leakage of fluid into the back of the eye, but they tend to resolve. Sometimes you may have an obstruction of a blood vessel in the back of the eye from uncontrolled hypertension, and that can cause loss of vision also. Those are more common non-communicable diseases that affect us or affect the eyes. We also have glaucoma, which is a chronic condition affecting the eyes that can cause blindness, and that's irreversible. So you should always get your eyes checked at least once a year or 18 months maximum.
All right, definitely for adults to be able to kind of stay on path and make sure that their eyes are functioning well. The WHO draws specific attention to child eye health this time around. Eye health services should be accessible, available, and affordable for all children around the world. That's the general message on this particular World Health Day. So very happy to hear that these services are indeed available here in Barbados and accessible.
That's correct.
It's just about making time. Can you walk into the clinics to be able to get the eyes checked, or must you call to make an appointment? How does it work?
It is preferred that you make an appointment. You call to make an appointment from outside, or when you take your child to get vaccinated for school entry, you can make the appointment there and then in the polyclinic. Not all polyclinics have the service, but the appointment can be made. If suppose you attend, for example, Moisbury Polyclinic, you can use the opportunity to make an appointment at Brantford Tate or Eunice Gibson, whichever is more convenient. Maybe sometime in the future we can have all polyclinics taking part in the program, but we have to see how we go with the first 4.
All right. Well, we certainly should try to see if we can make a list and get some parents on board. That is the general aim today on this World Sight Day. Children love your eyes. That's the theme for this time around. So make sure you take the children and get their eyes checked. You might be thinking that they're not necessarily paying the attention they need to in school and things of that nature, but it could be a sight problem. Again, thank you so much, Dr. Callender, for coming in and sharing with us today. And we look forward to sharing with you and the department throughout the year to hear how things are going and maybe to push some people in that general direction as well.
Thank you very much for the opportunity.
All right, so Dr. Callender is consultant in the ophthalmology department at the Queen Elizabeth Hospital. Again, happy World Sight Day to you, especially to all of the bespectacled people watching us here on Morning Barbados. How about that?
Morning, morning, morning.